Canada against decline, ignite passion, and restore our shining legacy. This channel is sick and tired of watching our great nation get flushed down the toilet by spineless liberals, unchecked mass immigration, and idiotic policies that prioritize everyone but actual Canadians. We're talking about a healthcare system that's a total disaster. Endless lines, not enough doctors, and breaking under the pressure of too many people flooding in.
From Vancouver Island to Newfoundland and Labrador, Canadian hospitals have had to turn patients away, clawing back hours and temporarily closing their doors. In Alberta, there have been 19 disruptions to emergency and ambulatory care facilities since the beginning of June. The province's official opposition says new data also shows ambulance response times have worsened and red alerts where there's no ambulances available have increased in frequency.
I see it with my own eyes that even in the urban centers like where I work, the wait times are longer and patients' families are having to make difficult choices.
On Sunday, Montreal Children's Hospital was forced to turn patients away due to overcrowding. And in BC, 4 interior hospitals announced temporary diversions. No matter where you end up, ER physicians are warning there's likely to be a wait.
There needs to be planning, and us on the front lines, we can only do so much. We try to help as much as we can. We lack the power to coordinate the whole system.
That, health experts say, will require the attention of all levels of government. But many Canadians don't have the luxury of time for policy to catch up to reality.
If you're as fed up as I am with this liberal-created nightmare, smash that subscribe button, hit the bell, and let's get into it. Welcome to Healthcare Hell. If you've ever waited hours in an ER before anyone helps, or been stuck on a list for surgery that drags on forever, this is your video. Our Canadian healthcare, the one we all pay for with our hard-earned taxes, is falling apart. Blame the Liberals in Ottawa. They've let mass immigration overload everything. Long lines, no doctors available, and immigration adding way more people than the system can handle. Today, I'll share the shocking numbers, real stories from everyday Canadians, and how the Liberals' open doors are crushing us. Let's break down the simple facts. In 2025, wait times for care are worse than ever. The Fraser Institute, a group that studies this stuff, says the average from seeing your family doctor to getting treatment is 30 weeks. That's over 7 months. We're one of the worst in the world statistically. Emergency rooms are a joke too. Reports indicate Nova Scotia, Ontario, and Quebec frequently experience waits exceeding 20 to 70 hours in severe cases. That's 3 full days sitting in pain. Now doctors, we're short big time. Canada needs 23,000 more family doctors right now, but we're only training about 1,300 new ones a year. It's like trying to fill a swimming pool with a teaspoon. Our system was already strained before the massive influx of newcomers, but now it's way worse. Over 6.5 million Canadians, 1 in 5, don't even have a family doctor. Clinics and rural hospitals are turning people away when the lineups are too long. This year alone, British Columbia has seen nearly 250 emergency room ER closures so far. Saskatchewan rural hospitals have experienced unprecedented service disruptions. Ontario continues to face intermittent shutdowns. In Manitoba, rural ERs collectively closed for tens of thousands of hours in recent years, with 2025 continuing the trend. This is Canadians suffering because the system can't keep up. And get this, all these waits cost us $5.2 billion in lost wages last year alone. Like throwing money in the trash while you sit painfully in a waiting room. Okay, this part's tough. The human side is easier to relate to than math and numbers. These aren't made-up tales. They're from real folks, like your neighbors or family. Last year, over 153,000 people were harmed in hospitals from mistakes or delays. 1 in every 17 states had problems. In 2025, things get even crazier. Specialists are quitting from burnouts because they have no choice but to work overtime in stressful conditions. If you still don't believe immigration has anything to do with hospital wait times, let me prove it to you. This first chart shows the beginning of the massive influx of immigrants starting in 2019 going into 2025. On this next chart, you'll see the start to the accelerated climb of hospital wait times correlates exactly to the beginning of the immigrants pouring in. Coincidence? I don't think so. Listen to this. A man named Rob Allison in Regina lost his wife because doctors gave a misdiagnosis of her brain cancer, delaying proper treatment. Once properly diagnosed, the following 10 weeks were described as a nightmare. Delays, miscommunications, doctors failing to show up for scheduled appointments, and a lack of proper guidance or support. She ended up dying in hospital hallways filled with fear and anxiety because there were no proper beds available and the facility was understaffed. Here's another example. In August 2025, Kay Roberts, a 36-year-old man from Saskatchewan, waited 9 hours in an emergency room due to severe overcrowding and overcapacity issues. He was eventually called by the doctors and diagnosed with dangerous swelling of the brain that required urgent intervention to prevent permanent neurological damage. For 5 days, he was placed on a stretcher bed in a busy hospital hallway where he underwent invasive medical procedures with constant foot traffic, bright lights, and a lack of privacy that made sleep nearly impossible. The most critical procedure was plasma replacement therapy, which involved inserting a large tube into his jugular vein to remove and replace his blood plasma, a process that took 3 to 4 hours and required boxes of plasma to be stored on the floor.
I have to admit, I was shocked when I read this story. I was really shocked that we had gotten to the point where these complicated medical procedures were being performed in a hallway.
The technicians performing the procedure expressed concern about doing it in such an unconventional and public setting, highlighting the staff's frustration with the conditions. The man suffered impaired cognition because of brain damage from the wait. This could have been avoidable. This next one's from a Canadian veteran in Toronto who publicly shared his heartbreaking story of losing his wife at the end of 2023 to what he described as inadequate health care.
My wife went undiagnosed properly and passed away November 22nd of 23.
I am very sorry.
And why? Because immigrants get goddamn health care. Am I pissed off? Yes, I am. It's not right.
You are right to be angry. You are
Right? I'm
angry and
accosted coming down the street being called a racist. I went overseas, ma'am. I left my family. It cost me.
Right to be angry.
You don't get it. I'm not saying we can't stop immigrants from coming in. We can't afford them now.
Estimates say 15,000 to 20,000 Canadians died last year waiting for surgeries or tests. That's like a small town wiped out in a single year. Unacceptable. This is our country failing its people. Mass immigration is like pouring gasoline on this fire. Liberals let in about 6.1 million newcomers since 2019. Total population boom with no plan for hospitals. Meanwhile, 5 million Canadians wait for a doctor. Many doctors and healthcare pros warn that this mismatch is wrecking care for everyone. Refugee healthcare costs are surging, straining everything we have and clogging lines. For those who think fresh arrivals or temporary visas are ineligible, get this: taxpayers totally foot the bill through federal programs like the Interim Federal Health Program, run by IRCC and paid for with our taxes. It covers essentials like meds, dental, and mental health for refugees and asylum seekers if they don't qualify for provincial plans. These people are often fleeing harsh environments and require more help than average Canadians. Costs have exploded. Do you see a correlation since the immigration boom in 2019? This is unmistakable. More people, fewer workers. It's a recipe for disaster. Yeah, sure, we're importing some doctors. It sounds great for our supply shortage, but this isn't helping because of our credential barriers. Our stricter rules and red tape prevent them from getting jobs in Canada as doctors. So they end up working as overqualified Uber delivery or taxi drivers. The Liberals are responsible for every bit of this. A decade of flooding the country with no extra doctors or beds. Now most of us can't get basic care. They ignore burnout, low pay, and shortages while adding patients by the truckload. They prefer to spend on useless vanity projects instead of investing on the required infrastructure, like more hospital beds, scanners, and boosting salaries to incentivize new doctors and nurses. We pay sky-high taxes for hallway medicine and deaths on lists. It's betrayal, plain and simple. Time to hold them accountable. Canadians, this is our fight. Share your stories below, spread this video, and demand Liberals halt the immigration surge and rebuild healthcare. Like, subscribe, join the movement. Stay strong. Let's save Canada before it's too late. Canada against decline. Ignite passion and restore our shining legacy.